You know that nagging worry when your usually spry, older dog or cat starts acting, well, old? Maybe they're napping more, seem a little less enthusiastic about their favorite things.
Hmm.
We often think, they're just slowing down. But if your furry friend also has kidney issues, that increased tiredness, that weakness, it could be a sign of something more specific going on, something, beneath the surface.
That's absolutely right. And today, we're taking a deep dive into exactly that. A very common and, well, really important complication for dogs and cats living with chronic kidney disease, or CKD.
And that is anemia.
Anemia, exactly. We'll be exploring the medical information that explains why this happens, how vets diagnose it, and importantly, what can actually be done about it.
Think of this as like your personal guide to understanding this piece of your pet's health puzzle. Our goal here is to sort of cut through the complex medical jargon
Yeah, definitely.
and pull out the crucial insights, those aha moments, so you feel truly informed, empowered to understand what your vet might be telling you without feeling like you need a medical degree yourself.
Precisely. We want to give you a clear, straightforward understanding of this particular type of anemia because it really is a significant health concern for these pets. We'll translate the technical bits into, well, plain English.
Okay, great. So let's dive right in. What exactly does it mean when we say a pet with CKD is also anemic? What's actually happening inside their body?
Right, so in this context, anemia means there's a progressive drop in their red blood cell count.
Mhm.
And red blood cells, well, they're vital, right? They carry oxygen all around the body.
The oxygen delivery system.
Exactly. We often measure this using something called PCV, packed cell volume. It basically tells us the percentage of blood that's made up of these red cells.
Okay.
In CKD-related anemia, this PCV and the overall red blood cell count and the hemoglobin level, that's the protein carrying the oxygen,
Hmm.
they all just steadily decrease.
So everything's going down.
Yeah, and what's really key here is why. The bone marrow, which is normally the body's factory for making new red blood cells, it just isn't keeping up. It's like
Ah.
the production line is slowed way down. The technical term is erythroid hypoplasia.
So the factory that's supposed to be churning out these oxygen delivery trucks, it's not working at full capacity.
Got it. And what about the trucks themselves, red blood cells? Are they like misshapen or not carrying enough oxygen?
That's a great question. But typically, no. The anemia we see with CKD is usually normocytic,
Meaning,
meaning the red blood cells are a normal size. And it's also normochromic.
okay,
That means they have the normal amount of that crucial hemoglobin. So the problem isn't really with the quality of the cells being made.
it's the quantity.
Exactly. It's that the bone marrow simply isn't producing enough new ones to replace the older cells that naturally wear out and get removed.
Mhm.
This makes it what we call a non-regenerative anemia.
Non-regenerative.
Yeah.
Meaning the marrow isn't regenerating or responding by making enough new cells. Spot on. The response isn't there.
Okay, so fewer normal red blood cells are being made. And you mentioned this often ties in with how advanced the kidney disease is. Can you explain that connection a bit more?
Yeah, absolutely. Generally, as the kidneys become more damaged and their function declines,
Hmm.
as the CKD progresses through its stages, the anemia tends to get worse,
Hmm.
more severe.
Ah, I see.
This connection is actually a really significant clue for vets when they're assessing a pet with kidney disease who's also showing signs of anemia.
Hmm.
It strongly suggests that kidney disease itself is playing a direct role.
Right, that makes sense. Okay, so we know what anemia in CKD looks like, basically a shortage of normal red blood cells, because the factory, the bone marrow, isn't producing enough. Now, what's the number one reason this happens when a dog or cat has kidney disease?
The main reason, the primary culprit, it boils down to a shortage of a really important hormone called erythropoietin, or EPO for
So
short.
EPO.
Think of EPO as the main messenger sent from the kidneys to the bone marrow. And this messenger's job is simple. Tell the bone marrow, get busy, produce more red blood cells.
So the kidneys are like the control center for red blood cell production, and EPO is the make more red blood cells now signal they send out. Is that kind of right?
That's an excellent way to put it, yeah. In a healthy animal, the kidneys are constantly monitoring oxygen levels. If those levels dip,
They send out EPO.
they release EPO, exactly. It travels to the bone marrow and stimulates it to ramp up red blood cell production.
Hmm.
It's this crucial feedback loop, to make sure the body always has enough oxygen carrying capacity.
Okay.
But when the kidneys are damaged by CKD, they just can't produce enough EPO.
Yeah.
So that make more red blood cells signal isn't strong enough or maybe doesn't get sent properly
Which leads directly to fewer red blood cells being made.
directly. The damaged kidney's inability to make enough EPO just disrupts that whole crucial communication pathway.
That makes perfect sense. It's like the communication line is down, or fuzzy at least. But I think you mentioned earlier it's not only the EPO issue, right? Are
Yeah.
there other things that can contribute?
Yes, that's true. While EPO deficiency is definitely the biggest piece of the puzzle, other things can certainly make the anemia worse. Pile on, so to speak.
Like what?
Well, things like small amounts of blood loss in the digestive tract, like little ulcers or irritation. Also, the red blood cells that are being produced might have a shorter lifespan than usual.
Oh, interesting.
Yeah, and then there are potential deficiencies. Maybe not enough of these essential building blocks like iron or folate that the bone marrow needs.
Raw materials for the factory.
Exactly. And even just general inflammation in the body, which is common with chronic diseases, can interfere with red blood cell production and survival.
Wow. Okay.
But it's really important to remember the insufficient EPO production is the primary driving force. These other factors, they're often secondary contributors, kind of amplifying the main problem.
Okay, got it. Mainly an EPO problem, but other things can make it worse. Now, who typically gets hit with this? Which pets are most likely to develop anemia with their CKD?
We usually see this develop in middle-aged to older dogs and cats, simply because those are the age groups where chronic kidney disease itself is most common.
Right.
However, it's important to know younger animals aren't immune. If they have inherited forms of kidney disease or develop CKD early for some other reason, they can definitely experience this anemia too.
Okay. And what are the signs? What might owners notice at home that could point towards anemia in their pet with CKD?
The signs are usually tied to the fact that the blood just isn't carrying enough oxygen.
Hmm.
So you might notice your pet becoming increasingly tired, weak maybe.
Less energy.
Yes, less energy. They might not want to go for walks as far or play as much as they used to. Appetite loss is common too, and consequently weight loss.
Hmm.
Some owners also describe their pets as seeming generally kind of down or depressed, less engaged with what's going on around them.
A bit apathetic, maybe.
Apathetic, exactly. You might also notice they get cold more easily. And interestingly, some pets can even show subtle changes in their behavior or personality. It must be, well, really worrying for owners to see those changes.
Oh, absolutely. And those all sound like things we might unfortunately just chalk up to an older pet slowing down, right?
They can be, yeah.
Are there any more specific physical signs that owners or vets might see?
Yes, definitely. One of the most telling physical signs is a change in the color of their gums or the inside of their eyelids, other mucous membranes.
What happens to them?
They might look much paler than usual. Instead of a healthy pink, they might look light pink or even whitish in severe cases.
Pale gums, okay. What else?
You might also observe your pet breathing faster than normal. So that's tachypnea. Their body's trying to compensate, trying to get more oxygen in.
Makes sense.
Similarly, their heart might beat faster, tachycardia. Again, trying to circulate the oxygen they do have more quickly. Sometimes a vet might even hear a heart murmur during an exam, which can be related to the thinner blood or the heart working harder. And in more severe, though thankfully less common situations, the lack of oxygen getting to the brain could even cause fainting spells or seizures.
Okay, those are definitely serious signs. Important things to watch for, especially if your pet already has that CKD diagnosis. Now, we know CKD itself isn't one single disease. What kinds of underlying kidney problems can lead to this whole anemia situation?
That's a great point. CKD is more of a syndrome, the end result of long-term kidney damage from various causes. So examples of conditions that can lead to CKD and therefore this anemia include infections in the kidneys, that's called pyelonephritis,
Okay.
or inflammation of the tiny filtering units, the glomerule, that's glomerulonephritis. Another one is amyloidosis, where abnormal proteins build up and damage the kidneys.
Mm-hmm.
Then there are inherited conditions like polycystic kidney disease, which is more common in certain cat breeds like Persians, and even some cancers like lymphoma can infiltrate the kidneys and cause CKD.
So a whole range of things can damage the kidneys enough to cause this EPO shortage.
Exactly. It's about understanding what's actually harming the kidneys in the first place.
And we also touched on factors that can make the anemia worse in a pet that already has CKD. Can we dig into those a bit more? Why do things like iron deficiency matter so much here?
Yeah, sure. So beyond the main issue of not enough EPO, several things can definitely exacerbate the anemia. Iron deficiency is a big one
Why?
because iron is absolutely crucial for the bone marrow to actually manufacture hemoglobin, the oxygen-carrying part of the red blood cell. Think of it like needing the right key ingredient for the factory to make the final product. If you don't have enough iron,
The factory can't work efficiently,
yeah,
even if it gets the signal.
precisely, then there's chronic inflammation. Doesn't really matter where it is in the body, but ongoing inflammation can interfere with both the production and the lifespan of red blood cells.
Okay.
Cancer, too, can have similar effects. And we mentioned gastrointestinal bleeding. Even very small amounts over a long time can lead to a significant loss of red blood cells and iron.
A slow leak, basically.
Kind of, yeah. And finally, other conditions that might cause the body to destroy its own red blood cells prematurely, that's called hemolysis, or diseases that directly attack the bone marrow itself, those can also worsen the anemia picture in a CKD patient.
So it really is a complex interplay. EPO deficiency is central, but all these other factors can act like, I don't know, roadblocks or detours for red blood cell production.
That's a good way to think about it, yeah.
Okay. So if a vet suspects anemia in a pet with CKD, how do they figure out if it's really due to the kidney disease and not something else entirely? Because you mentioned other things cause anemia too.
That's a critical question. Diagnosis involves putting pieces together and ruling other things out. The first step is exactly that, differential diagnosis. The vet has to consider all the other possible reasons for anemia.
Right.
We've touched on some anemias from chronic infections elsewhere, other inflammatory diseases, cancers not involving the kidneys, significant blood loss from trauma or surgery, primary bone marrow problems, hormone imbalances like hypothyroidism, even reactions to certain drugs.
Wow, lots of possibilities.
Yeah, and also things like immune-mediated anemias, where the body attacks its own red cells, toxins, certain viruses like FLV or FIV in cats, or blood parasites, so you have to sift through those.
How do they start sifting?
A key piece of the puzzle, as we said, is that the anemia of CKD is typically non-regenerative. The bone marrow isn't trying hard to replace the lost cells. That lack of a regenerative response, often shown by a low reticulocyte count, those are the young red blood cells, is a big clue pointing away from things like sudden blood loss or hemolysis, where you'd expect the marrow to be working over time.
Okay, so that non-regenerative nature is a major flag for CKD-related anemia. What specific tests does a vet usually run to confirm it?
Several key tests help paint the picture. The cornerstone is usually the complete blood count, the CBC. This will confirm the presence of that progressive non-regenerative anemia. Although it's worth remembering something we touched on, dehydration.
Right, common in CKD.
Very common. And it can sometimes temporarily mask the true severity of the anemia by making the blood seem more concentrated.
Oh, okay.
But yeah, a consistently low red blood cell count, low hemoglobin, low PCV, plus that low reticulocyte count that really signals the bone marrow isn't responding as it should.
Got it. And what about the other part of standard blood work, the biochemistry panel? What does that show?
The biochemistry panel is crucial for assessing kidney function itself.
Yeah.
In an animal with CKD severe enough to cause anemia, you'll typically see elevated levels of kidney waste products, blood urea, nitrogen, BUN, and creatinine. Phosphorus is often high too.
Those are the classic CKD markers?
Exactly. They're strong indicators of impaired kidney function. You might also see other changes, like variable calcium levels, often low bicarbonate indicating acidosis, and sometimes abnormal potassium levels, either high or low, depending on the situation.
And you mentioned something about the BUN to creatinine ratio.
Yes, sometimes if the BUN is disproportionately high compared to the creatinine, it can be a clue that there might also be some bleeding happening in the gastrointestinal tract, which, as we know, can worsen the anemia.
Interesting clue. Okay, blood work gives a lot of info. What about a urine sample? What can urinalysis tell us?
Urinalysis is also really important in evaluating CKD. It often shows that the kidneys have lost their ability to concentrate urine properly. The urine-specific gravity will be low. You might also find protein in the urine, which indicates damage to the kidney filters. And looking at the urine sediment under a microscope can sometimes reveal signs of infection or inflammation, depending on the underlying cause, the CKD.
Okay, so blood and urine tests give a pretty good picture of both the anemia and the kidney status. Are there other, more specific blood tests that might be useful?
Yes, we can do further tests. We can look specifically at iron levels. In anemia of CKD, the serum iron level might be normal or sometimes low, and something called transferrin saturation.
What's that?
Transferrin is the protein that carries iron in the blood. Saturation tells us how much of that protein is actually loaded up with iron. In CKD anemia, this saturation level can also be normal or low, often falling below about 20%. It helps assess if iron deficiency is playing a role.
Okay, useful for figuring out if iron is a contributing factor.
Exactly. And in cats, it's often standard practice to test for feline leukemia virus, FLV, and feline immunodeficiency virus,
Yeah.
FIV, and maybe blood parasites like Mycoplasma haemophilus, as these can cause anemia independently.
And for dogs?
For dogs, depending on the region and history, tests for tick-borne diseases like Ehrlichia or Anaplasma might be considered, as they too can cause anemia.
Right. And can you actually measure the EPO level itself?
You can, yes. Measuring the serum EPO level can be helpful. In animals with anemia not caused by kidney disease, you'd expect the EPO level to be high, right? The body's trying to stimulate the marrow.
Mm-hmm.
But in pets with anemia due to CKD, the EPO level is often inappropriately normal. It's not elevated despite the anemia, or it might even be low. This further confirms the kidneys aren't producing enough of this critical hormone.
That makes sense. It confirms the source of the problem. What about looking at the kidneys with imaging, like X-rays or ultrasound? Does that help?
Imaging is definitely valuable for assessing the kidneys themselves. In many cases of chronic kidney disease, the kidneys actually appear smaller than normal on ultrasound or X-ray, and they might have an irregular shape or texture, indicating long-term scarring and damage.
Smaller kidneys.
However, depending on the specific underlying cause, they could also look normal or even enlarged. For instance, in polycystic kidney disease, you'd see multiple cysts, or if there's a tumor like lymphoma, the kidneys might be enlarged. So imaging gives structural information.
Gotcha. And lastly, are there any more invasive tests, like looking at the bone marrow itself?
Yes, in some complex or unclear cases, a bone marrow examination taking a small sample of bone marrow, usually from the hip or shoulder, might be recommended.
What would that show in CKD anemia?
It typically shows what we discussed earlier. Fewer red blood cell precursor cells being produced. That's the erythroid hypoplasia. But, importantly, the production of other blood cell types, like white blood cells and platelets, is usually normal or even increased relative to the red cell precursors. The ratio of myeloid, white cell precursors, to erythroid, red cell precursors, the ME ratio is typically normal or high.
And iron stores in the marrow.
The amount of iron stored within the bone marrow itself can be variable. Sometimes it looks normal, sometimes it might be low, reflecting potential concurrent iron deficiency.
Okay, so it sounds like a really thorough investigation using a combo of blood tests, urine analysis, maybe imaging, and sometimes even that bone marrow look helps really nail down the diagnosis.
Exactly. It's about putting all those pieces together.
All right, now let's move on to the important part. What can actually be done once a pet is diagnosed with anemia because of their CKD? What are the main treatment approaches?
The initial focus is often on stabilizing the pet overall, especially if their kidney disease is quite advanced and they're feeling pretty sick.
Makes sense. Foundational stuff first.
Right. This includes things like make sure they're getting adequate nutrition, maybe through appetite stimulants or special diets. Correcting any metabolic imbalances is key, things like dehydration, electrolyte problems, or acidosis, that metabolic acidity.
Mm-hmm.
We also need to address any deficiencies in those building blocks we mentioned, like B vitamins or iron, that could be hindering red blood cell production. If there's any suspicion of bleeding in the gut, that needs to be managed, often with medications like antacids or stomach protectants.
Okay.
And ensuring the pet has enough iron available is crucial, as we discussed. Plus, managing high blood pressure, which often goes hand in hand with CKD, is also really important for overall health and can sometimes impact anemia treatment.
Okay, so lots of supportive care aimed at the CKD itself and related issues. What about treatments that specifically target the low red blood cell count?
For directly tackling the anemia itself, there are really two main strategies. One is blood transfusions. This is generally considered a short-term rescue measure. It's for pets with severe anemia, where their PCV has dropped to dangerously low levels, usually we think below about 15% or so, and they're showing significant clinical signs because of it, like extreme weakness or difficulty breathing.
So it's like a rapid boost.
Exactly. A transfusion of compatible blood can quickly raise their red blood cell count and improve oxygen delivery, buying some time or stabilizing them for other treatments. The goal after a transfusion might be to get the PCV up into the mid-20s or maybe 30%.
Are there downsides?
Well, it's temporary, and repeated transfusions can become problematic. The pet's immune system might start to recognize the donor blood cells as foreign and develop antibodies, making future transfusions less effective or even risky due to reactions.
Okay, so transfusions are more for critical situations, What about longer-term treatments focused on that underlying EPO problem?
That's where the EPO replacement therapy comes in. We have synthetic versions of erythropoietin available for veterinary use.
Ah, the hormone itself, or a version of it.
Yes. One of the first ones developed was epoetin alpha, which is a recombinant human EPO, often called R-Weibo.
Okay.
However, a newer medication called Darbepoetin alpha has largely become the preferred choice for most vets now.
Darbepoetin alpha. Why is it preferred?
Darbepoetin is also based on human EPO, but it's been modified, engineered to last longer in the body, so it has a more sustained effect, meaning fewer injections are typically needed.
Longer lasting, fewer shots. Sounds good.
Yes, and perhaps even more importantly, it seems to carry a significantly lower risk of causing the pet's immune system to develop antibodies against it compared to the older epoetin alpha. That antibody formation was a major concern with epoetin.
Ah, okay. Lower risk of the body rejecting it, basically. So how are these EPO-like drugs used? What's the goal?
The general goal for PCV, the red cell percentage, in both dogs and cats getting this therapy, is usually around 30%, maybe slightly higher for dogs, like 30–35%. We don't aim for completely normal levels, just enough to alleviate the clinical signs of anemia.
Okay, aiming for 30%. How often are the shots given?
With Darbepoetin alpha, the usual starting approach is an injection once a week, either just under the skin or sometimes into a vein. This continues until the PCV starts to consistently reach the lower end of that target range, say around 30%.
Ah,
Once the PCV is stable in that target zone, the frequency of injections can often be reduced, maybe to once every 2 weeks or even once every 3 to 4 weeks, depending entirely on the individual pet's response and how well their PCV holds up.
so it's very individualized.
Very much so. For the older drug, epoetin alpha, the initial dosing was typically more frequent, like 3 times a week, until the target PCV was hit, and then frequency might be reduced to once or twice a week for maintenance.
Requires a lot of monitoring, I imagine.
Absolutely critical. And one vital point, you must check the pet's PCV level before giving each injection of either drug
Why is that?
to avoid overshooting the target. If you give the dose and the PCV is already high enough or climbing too fast, you risk making the red cell count too high, which has its own set of problems.
Right, like thick blood.
Exactly. Increased blood viscosity, risk of clots. So if the PCV goes above the target range, say over 35% for dogs, or maybe over 30–32% for cats, the medication should be temporarily stopped until the PCV drifts back down into the desired range.
Okay, constant adjustment. What if a pet needs to switch from epoetin to the newer darbepoetin?
There's a generally accepted conversion factor vets use. Usually the weekly dose of darbepoetin is calculated based on the total weekly dose of epoetin the pet was receiving.
Got it. And is this usually a lifelong treatment?
For most pets with significant anemia due to CKD, yes, it often becomes a long-term or lifelong commitment, as the underlying kidney disease isn't going away.
Right. Now, you stressed the importance of iron earlier. How does that fit in specifically with EPO therapy?
It's absolutely crucial. You cannot effectively treat with EPO if the pet doesn't have enough iron.
Why not?
Because remember, EPO is the signal telling the bone marrow factory to make red blood cells. But iron is the essential raw material needed to build the hemoglobin within those cells. If the factory gets the signal but doesn't have the materials.
Nothing gets built. Or not enough, anyway.
Precisely. So it's really ideal for the pet's iron levels, often assessed by checking serum iron and that transferrin saturation we talked about, to be within the normal range before even starting EPO therapy.
And during treatment?
And they need to be checked regularly during treatment as well. Because as the bone marrow ramps up production in response to EPO, it uses up iron reserves quickly. Iron deficiency can actually be a common reason why some pets don't respond well to EPO therapy initially.
Ah, okay. So if iron is low, what do you do? Supplements?
Yes, iron supplementation is often needed. Interestingly, for pets with CKD, giving iron as an injection is frequently preferred over oral pills or liquids.
Why injectable?
Absorption of oral iron can be a bit unreliable in pets, especially those with kidney disease who might also have some gut issues. Injections bypass the gut and ensure the iron gets into the system more effectively.
Makes sense. Are there any species-specific EPOs available? Like a dog EPO for dogs or cat EPO for cats?
That would be ideal, as it would likely reduce the risk of antibody formation even further. Unfortunately, while some research has been done, species-specific recombinant EPOs are not currently widely commercially available for dogs and cats, so we primarily rely on the human-derived ones like darbepoetin and epoetin. There's ongoing research into other ways to stimulate red cell production, though.
Good to know. What about other medications? I feel like I might have heard about anabolic steroids being used for anemia sometimes. Is that relevant here?
That's something that does come up. Anabolic steroids were used historically for some types of anemia in both people and animals. However, for the specific anemia caused by EPO deficiency in CKD, well, they're generally not considered effective or recommended.
Why not?
They don't really address the core problem, which is the lack of the EPO signal to the bone marrow. Their effects on red blood cell production in this specific context are minimal and often outweighed by potential side effects. So the focus stays on managing the CKD, ensuring iron adequacy, and using EPO replacement when appropriate.
Okay, that's clear. So for pets who are getting EPO therapy, what kind of monitoring schedule is typical, and what are the potential bumps in the road, the complications that owners should be aware of?
As we mentioned, careful monitoring is absolutely key. Initially, when starting therapy or adjusting doses, the PCV should probably be checked quite frequently, maybe weekly, or at least every 2 weeks, for the first couple of months.
Okay, frequent checks at first.
Yes. Then, once the red blood cell count seems stable within that target range on a maintenance dose, the frequency can often be stretched out perhaps to monthly or even every 2 months, depending on the individual case.
And other things besides PCV?
Blood pressure is important to monitor regularly, as EPO therapy can sometimes cause or worsen hypertension. So checking blood pressure perhaps every 2 weeks to monthly is wise, especially early on. And those iron levels, serum iron and transferrin saturation, should definitely be monitored. Good practice is often to check them around 1 month, 3 months, and 6 months after starting EPO, and then maybe twice a year after that, assuming things are stable.
Got it. And under what circumstances would a vet decide to stop the EPO therapy altogether?
There are several specific situations where stopping EPO is necessary. One we mentioned is if the pet develops an excessively high red blood cell count that's called erythrocythemia or polycythemia that persists despite dose reduction.
Okay. Too much of a good thing.
Exactly.
Yeah.
Also, if the pet shows any clear signs of a negative reaction or sensitivity to the medication itself. A big one is if tests confirm the development of those anti-EPO antibodies we talked about, meaning the drug is no longer working and might even be harmful.
Right.
Related to that is the development of a very specific and severe type of anemia called pure red cell aplasia, or PRCA, which is strongly associated with antibody formation.
PRCA. Okay.
And finally, if the pet develops severe high blood pressure that simply cannot be controlled adequately with medications while they're on EPO, stopping the EPO might be necessary.
Okay. You mentioned potential complications related to the EPO therapy itself. Can we break those down a bit? What are the main risks?
Sure. The most common potential issue is actually achieving too high a red blood cell count, that erythrocythemia. While we aim for 30–35%, if it goes much higher, it thickens the blood and can increase the risk of blood clots, high blood pressure, and even seizures in some cases.
So careful monitoring prevents that. What else?
Seizures are listed as a potential, though less common side effect, possibly related to rapid changes in blood viscosity or blood pressure. The development or worsening of high blood pressure is definitely a known risk. We've talked a lot about iron. If supplementation isn't adequate, the therapy itself can deplete iron stores, leading to iron deficiency, which then makes the EPO less effective.
Right, the raw material issue again.
Exactly. Some pets might experience discomfort or skin reactions at the injection site, though that's usually minor.
Okay. And that serious one you mentioned, PRCA.
Yes, pure red cell aplasia. This is probably the most serious potential complication, although thankfully relatively uncommon, especially now with the preferential use of Darbepoetin.
What exactly happens in PRCA?
It occurs when the pet's immune system develops antibodies that not only attack the injected synthetic EPO, but also cross-react and neutralize the pet's own naturally produced EPO, whatever little amount that might be.
Oh, wow. So it wipes out all EPO signaling.
Essentially, yes.
Yeah.
This leads to a sudden and severe non-regenerative anemia. The bone marrow production of red cells just shuts down completely. It was seen more often with the older epoetin alpha products.
Is it reversible?
Fortunately, yes, it's often reversible if the EPO medication is stopped immediately. The antibody levels gradually decline, and the bone marrow can eventually recover, though the pet might need significant support, including transfusions, in the meantime.
That's scary, but good. It's reversible.
And less common with Darbepoetin, you said.
Yes, significantly less frequent. Studies suggest the incidence of antibody-mediated PRCA with Darbepoetin is likely less than 5% of treated patients, whereas it was estimated to be higher, maybe up to 20–30% or even more, with some older formulations of epoetin in some reports.
That's a big difference. How would you know if antibodies were forming, especially with epoetin? Key signs would be a decreasing PCV, despite being on regular EPO treatment, a very, very low reticulocyte count, indicating no new red cell production, and specific findings on a bone marrow exam showing a near absence of red blood cell precursors, but normal numbers of other cell lines. Specialized tests can also detect the antibodies themselves.
Okay. So bottom line, be cautious or hold off on EPO if blood pressure is uncontrolled or iron is deficient until those are sorted.
Absolutely. Get those under control first for the best and safest outcome.
Got it. And briefly, what about complications from blood transfusions if those become necessary?
Transfusions have their own set of potential risks. The main ones include incompatibility reactions if the donor blood isn't a good match, ranging from mild fever to severe shock. There's also a risk of fluid overload, especially in pets with heart or kidney issues.
Mm-hmm.
Giving packed red blood cells can also lead to iron overload over time with multiple transfusions. Temporary increases in blood pressure can occur. And although screening is very good these days, there's always a very small theoretical risk of transmitting bloodborne infections.
Okay, so lots to consider and monitor with treatments. Thinking about the bigger picture, what's the general outlook when the anemia is effectively managed, and what's the overall prognosis for these pets?
Well, when the anemia is successfully corrected, or at least significantly improved with EPO and supportive care, owners often see a really wonderful improvement in their pet's quality of life. It can be quite dramatic.
What kinds of changes?
They might regain their appetite, have much more energy, become more active again. You might see them grooming themselves properly again, seeking out affection, maybe even becoming playful. Weight gain often follows improved appetite. They might tolerate cold weather better and spend less time just sleeping.
So real noticeable improvements in day-to-day well-being.
Absolutely. It can make a huge difference to how they feel and interact. However, and this is the crucial part, it's vital to remember that treating the anemia doesn't cure the underlying kidney disease.
Right. It manages a major symptom.
Exactly. So the long-term prognosis, the overall outlook, is still primarily determined by the severity and the rate of progression of the chronic kidney failure itself. And unfortunately, for pets with moderate to advanced CKD, the long-term prognosis generally remains guarded to poor.
Mm-hmm.
So the decision about whether or not to pursue EPO replacement therapy always involves a careful discussion between the vet and the owner, weighing the potential benefits for quality of life against the potential risks, the cost, the need for monitoring, all considered within the context of that individual pet's overall health and the stage of their kidney disease.
That's a really important perspective. It's about improving comfort and well-being for the time they have, while being realistic about the underlying condition. So as we wrap up this deep dive, what would you say is the single most important takeaway message for our listeners today?
I think the key thing to remember is that a shortage of the hormone EPO, produced by damaged kidneys, is the #1 cause of the anemia we see in dogs and cats with chronic kidney disease. And while this anemia can really drag a pet down and negatively impact their life, we do have good diagnostic tools to identify it, and importantly, effective treatment options available, especially EPO replacement therapy, usually with Darbepoetin alpha now, which can often lead to really substantial improvements in their energy, their appetite, and their overall quality of life.
That's great to hear. And for listeners out there who have a pet with CKD, and maybe they've been noticing some of the signs we discussed, the increased tiredness, the weakness, maybe those paler gums, what should their immediate next step be?
The absolute best next step is to have an open and honest conversation with their veterinarian. Share exactly what you've been observing at home. Ask specifically, could anemia be contributing to these signs?
Don't be afraid to ask.
Not at all. Your vet can then perform the necessary blood tests, like the CBC and reticulocyte count, to determine if anemia is present and how severe it is. And if it is diagnosed, they can discuss the most appropriate monitoring and treatment options tailored specifically to your pet's individual situation and stage of CKD. It's all about teamwork, understanding what's going on, and working together to provide the best possible care.
It really underscores how gaining that deeper understanding, of the why behind the symptoms, the mechanisms of these chronic diseases, can empower us as pet owners to make more informed decisions and ultimately make a real difference in the daily lives of our animal companions, even when we're facing difficult long-term challenges. Thanks so much for shedding so much light on this really important topic today.
It was my pleasure. It's a common issue, and hopefully this helps owners understand it a bit better.